If you have diabetes or you've been diagnosed recently, you may notice some unpleasant headaches once in a while. I'm here to talk about what diabetic headaches are, what causes them, and what you can do to avoid them. Hey, by the way, my name is Scott, and I'm here to be your special guide in answering all your questions about diabetes. So, let's get started. Okay, guys, first, you need to know that headaches can be classified as either primary or secondary. Simply put, primary headaches don't relate to any other condition. Good example would be migraines. On the other hand, secondary headaches are caused by other medical conditions or health issues, including diabetes. But here's the main question. What exactly causes those headaches when you have diabetes? Well, they typically develop because of changes in blood sugar levels. A headache can indicate that blood sugar levels are too high, which is called hyperglycemia. Conversely, blood sugar levels may be too low, which is called hypoglycemia. I'll talk about that more in a minute, so keep watching. People with a recent diagnosis, they may experience headaches more often. And that's because they're still trying to manage their blood sugar levels and find a regimen that works for them. People with diabetes who manage their condition well and keep their blood sugar levels under control, well, they're less likely to experience headaches. So if your diabetes is uncontrolled and the fluctuations in blood glucose levels are high, you're likely to have headaches more often. Hey, before we continue, don't forget to subscribe to the Klinio channel so you don't miss out on future diabetes management videos. Also, check the link below this video for a 60-second quiz to evaluate your diabetes health state. All right. So I briefly mentioned hyperglycemia and hypoglycemia. Now I want to explore this more deeply since it's really important for people with diabetes. So let's start with hyperglycemia, which, as I mentioned, is the medical term for high blood sugar levels or too much glucose circulating in the blood. However, other symptoms of hyperglycemia that you can see on this list are often slow to appear, and they don't usually occur until glucose is above 200 milligrams per deciliter. While we're on the topic of headaches, they can take several days to develop, and they're considered an early sign of hyperglycemia. The pain can become more severe as your condition worsens. Okay, so what should you do if you have headaches caused by hyperglycemia? Well, first of all, realize that hyperglycemia is a serious condition that requires rapid management because high glucose levels can damage the blood vessels and nerves. Hyperglycemia can be managed in just a few steps. Number one, make lifestyle changes that include a healthy diet and exercise. 2, check blood sugar levels regularly. And finally, take medications if prescribed by your doctor. Keep in mind that when your blood sugar is controlled, you'll likely find that you have fewer headaches. Okay, now let's talk about hypoglycemia, the medical term for low blood sugar levels. Hypoglycemia is defined as having blood sugar levels below 70 milligrams per deciliter. It can occur in people with diabetes if they take too much insulin or they don't eat enough carbs. This too is a serious condition since glucose is the primary source of fuel for many cells in the body, including those in the brain. Headaches in such cases are usually accompanied by other symptoms of hypoglycemia that you can see on this list. The symptoms here are typically sudden and may seem to come out of nowhere as your blood sugar decreases. Now you may be asking, how do you treat headaches caused by low blood sugar? Well, the first step in treating this kind of headache is to confirm that the pain is occurring due to low blood glucose. So here you need to take a blood glucose test, and if it verifies the issue, you need to head to the next step. Eat 15 grams of carbs or glucose tablets to raise blood glucose, and then check your sugar again in 15 minutes. If it's still below 70, well, have another serving. Once blood sugar returns to the target range, the headache should subside. Also, try to make notes about such episodes and talk with your doctor about why it happened. Health professionals can suggest the most effective ways to avoid low blood glucose in the future. Okay, I've dropped loads of information here. So if you have any questions about diabetes and headaches, leave a comment below this video and I'll answer ASAP. And listen, you have to remember, it's essential to control blood glucose levels and practice effective diabetes management. And always consult a doctor before making changes to your diet, your physical activity regimen, or medication. That's it for today. Watch the following videos on how to check your blood sugar and how to create a meal plan when you have diabetes. Thanks for watching. We'll see you next time.